Hey everybody, so I'm here with John Hurst. John and his wife Katie are part of our church family, and this is part of our Frontline series where we're interviewing people in our church that are on the front lines as it relates to COVID-19. So John, why don't you tell us a little bit about yourself, where you work, what your job entails?
All right. So I'm a infectious disease pharmacist. I specialize in infectious diseases after finishing pharmacy school, and I've been practicing that for about 8 years now. And I work at a company called Biomérieux, which is a French diagnostics company that operates globally. So we
Do
make
you speak
infectious
French?
disease. No,
Okay. I didn't know.
les incompétents.
Okay.
And I think that means I'm incompetent, but I heard it in Home Alone. So that's about right.
Okay. Sorry to interrupt you. Go ahead.
Yeah, so I work for a French diagnostics company that makes and manufactures technology and infectious diseases tests to diagnose them and monitor them. And yeah, so my job's basically showing clinicians the value of diagnostics through consultancy and through a visual analytics platform that I work
Okay. It sounds complicated.
on. Katie told me, good luck explaining what you do. So.
Right. Oh man. Well, thanks for what you do. And we were talking before we started recording, you normally are traveling a lot, right? So that's
Yeah,
changed.
yeah. So usually I'm on the road quite a bit. That's probably an understatement, but I'm out there a lot. Luckily, I'm able to make it home most weekends for church and everything. But we do a lot of traveling to hospitals and to conferences, and I was actually supposed to be in France this past week. So
Okay.
uh, life is very different now that we're not running around the world.
Yeah. So what else about your job has changed since COVID-19 started?
Yeah, I mean, we are basically, we typically interact with hospitals on a frequent basis. In a sales capacity a lot, but now it's completely just trying to get them enough products to get the job done. And we're making new tests and new technologies as well. We're launching those, but it's all video conferencing now. So it's
Hmm.
Microsoft Teams and WebEx and Zoom meetings like crazy. So
Yeah. Well, so based on your knowledge, you're a pharmacist essentially, but you're kind of on the tech side of pharmacy. Is that right?
that's
Sort of.
yeah.
Okay. So based on your knowledge about COVID-19, what is something that we as a church, we as the public need to know based on your understanding of this disease?
I think understanding is a good word. There's a lot of information out there, and I think if you're running into someone who says they know what's going on, take a step back from that and realize that not we don't know a lot yet. It's
Hmm.
still very early, so make sure you're getting your information from someone like the CDC. Really and truly, it's not time to definitively say I know what's going on, and I'm not going to claim to have all the answers or anything, but
Hmm.
as a church, if you're sick, please stay home. When we do, resume some kind of services. If you are in a vulnerable population where you might have some health issues pre-existing or being that more senior population, you need to avoid exposure until we have a vaccine, which is very difficult, I understand. But there's things we can do to limit our exposures. You've seen a lot of them out in public, staying 6 feet apart, trying to stay in well-ventilated areas. If you think someone's sick, stay away from them. That's a good one.
Hmm.
And then for those of us that are on the healthier side, wear masks. You can transmit this and be asymptomatic, meaning you don't show any symptoms, you don't feel like you're sick. So to me, I'm wearing a mask every time I'm in public. I'm at the grocery store, I'm picking up food. I'm going to wear something to cover my face. And yeah, it's uncomfortable. Sometimes it's hot. But it's basically, my mask is saying, I love you to the other person.
Yeah.
I don't want to get anybody sick. I don't want to contribute to someone else getting sick. That, I don't know who's on chemotherapy. I don't know who has a suppressed immune system.
Mm-hmm. Yeah, that's good. That's good. So you mentioned vaccine. What's your anticipation of when a vaccine might be ready for public consumption?
I'm not going to pontificate on it. I don't have any answers.
Mm-hmm.
Everyone's trying as hard as they can. I think there's some great efforts being made, but there's no promises.
Yeah. Yeah. Well, it kind of goes back to the first thing you said. If somebody says they know what's going to happen, take a step back.
Yeah.
Yeah.
Absolutely.
Well, how can we as a church pray for you and other pharmacists and other coworkers?
Yeah. We as a company, we've got people that are in the field actually having to go and service our technology in hospital settings. So, praying that they stay safe, that they're able to keep those machines working so that the doctors and nurses and everyone out there they have that information to support them in their care of those patients. And then pharmacists, a lot of them have been able to do a fair amount of their work remotely. But there are some colleagues I know of that have been, laid off or have had to take significant pay cuts and things. So it's a difficult situation. And so keep them in your prayers for sure.
Yeah. Yeah, we will. Yeah. So church family, I encourage you to pray for John and Katie and all the pharmacists and all of those in our church family that are on the front lines. And John, we want to say thanks for what you're doing and pray your safety and health for you and your family, and also God's blessings on you as you continue forward. So
thanks
for your time today, man.
All right, talk to you later.